If you take Focalin or Focalin XR, which are dexmethylphenidates, for your ADHD, you may want to consider switching or talking to your provider about Azstarys. So because of the ADHD medication shortage, it's been for several years very difficult to get some ADHD medications. At first, it seemed like really the problem was with Adderall or Adderall XR. Then it seemed like Concerta, Ritalin, and Vyvanse also became very difficult to get. And finally, Focalin has also been challenging at times for patients to get consistently. If you do have ADHD and these medications work for you, being on a consistent regimen, having a good routine with your medication, and not having disruptions in your medical care because of the ADHD medication shortage is incredibly important. We all know that. And so there are options out there that might really work for you that you can get consistently, but you need to work with a provider that knows the psychopharmacology of these medications and also has relationships with the pharmaceutical companies that make these medications in terms of knowing what promotions or coupon codes, how to get patients these medications or make sure they can fill them consistently, and also have relationships with specialty pharmacies that can tell patients where to go to get some of these branded medications. So if you're taking Focalin, again, that's dexmethylphenidate. Azstarys is a newer branded medication that has basically it's a combination of your immediate release Focalin or dexmethylphenidate, and then it's got a prodrug in it, which means that it's serdexmethylphenidate. The other component of Azstarys, serdexmethylphenidate, is converted into Focalin throughout the day, and so you're basically again you're getting the same active ingredient. Immediate release Focalin, and then a prodrug that's turned into Focalin throughout the day, as you would if you were taking Focalin. So why is that important? Well, if you're tolerating Focalin and it works well for you, then you could expect there's a very high likelihood that you will also tolerate a medication that is Focalin and turned into Focalin throughout the day. And it's very likely that it will work for you in a very similar way that the Focalin worked for you. And so your body's already used to the active ingredient of the medication. However, the big difference here that I'm going to bring up is that because it's a branded medication, it's much more readily available, especially if you have commercial insurance. It's much easier to get this medication than getting Focalin filled at your local pharmacy. And so it may be a really great option that will work for you, that your body's already used to. And it's just a different pill form that you will likely be able to get more consistently so that your ADHD medication treatment isn't always disrupted.